Hi, my name is Dean Katowski. Welcome to Performax Physiotherapy and Sport Rehab. I'm here with my good buddy Todd the Rock. Todd is in today because he's experienced some problems in his right hip and is now his left hamstring. And I want Todd just to give a little brief summary of what brought on this, what brought on the mechanism of injury here.
Just an innocent little vacation with my kids. I was on some water slides and I was going down the water slide. And
So he's doing so for, you know, you can make this real.
I got airborne on one of the turns and went up in the air and landed back flat on my right hip.
Right. So he's hit his trochanter, which is that outside bony part of your hip, that little knob there. And what's happened is he's leveraged his pelvis out and forward as a result. And I'll show you that in a minute. So you mentioned something was up with your left hamstring?
Oh, yeah, so this happened a few weeks ago now. It's been, my left hamstring's been bothering me running and exercising, and yesterday it actually just basically got tweaked. It felt like I tore it or pulled it bad, so
Yeah, so
hence the phone call to you and
yeah,
visit.
so I see this, I see this type of injury, not the water slide thing, it happens all sort of different ways, but this type of problem is very common. I don't believe it's, in my opinion, I don't believe it's treated or handled properly, only because I see the end results of chronic low back pain. And this is probably malalignment of the pelvis, or in traumatic and or non-traumatic malalignment of the pelvis, probably one of the biggest reasons for ongoing low back and hip pain clinically that I've seen in my 22 years of doing this. So I just want to show you guys how easy and simple this is to assess and how easy this is to treat. So I'm just going to do a simple test here. What we do is we want to look at these 2 points here on the pelvis. They're called ASIs. It doesn't matter what the name is, but I'm going to use them as landmarks. And when I landmark them in a normal pelvis, I want to see a nice straight line. Now I've already had the privilege of looking at Todd's pelvis, and he's way out, but I'm going to show you how way out he is. So I look away so I don't bias myself, and I'm just going to look away. And I'm going to landmark left side, then we're going to landmark right side. Now maybe Alana, you want to come in here. And if you look down at my hands, so left side, right side, if you look down at my hands, you can see very easily that this right side is lower, quite a bit lower than this left side. And this right side should be about there, which it isn't. So that tells me more or less immediately that that right innominate or pelvic bone has been shifted forward. Okay, come on out here. So what I want to do is, show you guys mechanically how this affects you, strength-wise. So Todd, if you could brace yourself, please. I'm going to get you to lift the right leg in the air. We're going to turn this right leg out. Now I'm biasing the, sorry, let's just lower this. Now let's show that, guys, what we're doing here. So what I'm doing is I'm biasing the hip flexor muscle, psoas major. Some of you may have heard of it. The psoas major, it comes off the side of the lumbar spine, and it runs down and attaches onto the, we'll call it the hip bone, if you will. So when it contracts and shortens, it comes up, it raises the femur into, and the hip into flexion. It's the primary hip flexor, and when your pelvis is out, I'll show you exactly what happens to that muscle. So we'll just raise it up, hold out to the outside, good. Okay, I'm going to push down and I'm going to get you to resist me here, straighten that leg, good. Okay, 1, 2, 3, push, strong. Give me everything you've got. I'm going to use 2 fingers now, everything, Toddy, everything. Okay, so that's quite weak. We're going to do the same thing on the other side. Same bias, good, straighten the leg, good. So I stabilize the opposite side of the pelvis. Okay, 1, 2, 3, push please, push, good. I'm going to use 2 fingers now, push. I'm not going to move them, I'm going to strain my wrist doing it. So that's, immediately I know we've got weakness in the anterior part of the pelvis, if you will, in one of your basically major core muscles. So that's not good, especially if you're trying to run. The other thing, the other muscle that's greatly affected, just turn on your side, is gluteus medius. Gluteus medius is a lateral stabilizer of the hip, right here. And when you stand on one leg, it's this muscle and the opposite side of your low back that prevent you from falling over. So when you're in single leg stance, if this muscle is weak and you're running, you're going to have a moment in your gait where you shift like this to the outside. Absolutely detrimental to your body and your end result of runners. So all you sprinters out there, or any athlete that's running, if your pelvis isn't aligned and you got gluteus medius weakness and your trainer or whomever is getting you to do thousands of glute medius exercises, but they haven't looked at your pelvic symmetry and you're not getting anywhere, you need to check this out immediately. So let's have this turned in. And once again, I'm going to get you to resist me, please. Let's have a push. Strong, strong. Give me everything you got. We're going to two-finger it now. Don't mean to make you feel bad. Let's have it. Let's push, 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 push. Okay, so we'll do the other side. Same test, so we'll just bias that. Let's bring that right back just a little bit more. Good, perfect. Okay, good. Hold strong. 1, 2, 3. 1, 2, 3. Excellent. Good. Two-finger test. 1, 2, 3. Push. Okay, I'm going to strain myself again. So from this quick assessment, now there's two other things that I look at. From this quick assessment, I know we've got muscular weakness. So when he's standing, he's going to be weakened. When he's trying to run, it's going to be a mess. So there's two other things I look at. One is leg length discrepancy, which he has. So I'll typically get the knees up. We'll bridge. So just bring the bum up, perfect, down. We'll bring these legs out here, and there's probably about, I'd say, well, I'm not exposing them. I can see the malleoli through the sock, but he's got a ½ an inch gap there. Let's have you stand, Todd. One last test. Hands on the wall, please, in front of you. So what we're going to look at is we're going to look at how well this innominate bone is. Come over here a little bit, Alana, please. Just right there. Good. How well this innominate bone is rotating, and whether or not there's any movement at this SI joint. There's probably 2 to 6 degrees of movement at this joint that we've been able to see studying cadavers. There are some anatomists that actually don't believe there's any movement at this joint. They believe that it's kind of actually ridiculous that we'd actually even say that there's movement at this joint. Just back out just a touch. So if I landmark his PSIS, which are these guys right here, I'm just going to put a thumb on the sacrum, a thumb on there, and I want to see my thumbs drop down when he flexes his hip. So you can see these dimples here. Here's the sacrum. So here's the tailbone per se. Here's the PSIS right about there. I'm going to put my thumb right there. I put my thumb on the sacrum. Now raise your right knee, please, Todd. As high as you can go. Down. And again, please. And down. Okay, so there's some movement there. What I want to see is this thumb drop down, and then this guy here. Left side up and down. And again, and down. Okay, now we can do this as well. So let me just see. Actually, okay, now do both sides. Up in the air. Sorry, that's my bit of fun. So have your, I actually had people do this before, which is awesome. I love seeing that. So so that's the first stage of this. We're going to do some work with Todd. Now my whole goal right here, right now, is restoration of alignment and stability of this pelvis. I've got my own little technique. It involves shortening some muscles. It involves exercising some muscles. I'm using acupuncture, stim, massage, muscle energy technique, all the goodies, and then we'll show you, we'll come back and show you what the final product of all of this is. Cheers.